Thank you, Madam Speaker, for giving me this opportunity to add my voice to this very important bill. Madam Speaker, I have been looking forward to this minute because I know how important this bill is, and putting into consideration the challenges that Kenyans have been going through in terms of health facilities and funds that are managed under NHIF, that has made many Kenyans to suffer in different ways because of lack of accountability and many other things that have been going on. Madam Speaker, looking at this bill, I feel that through this bill, we will be able to transform the health sector, and we will be able to promote implementation of universal health in every part of this country. And again, we will make sure, or we will ensure that all Kenyans receive equal opportunities in terms of service delivery and also helping our people. I was going through the bill, and I want to appreciate the work of the Health Committee and what they have done so that we come up with this. Madam Speaker, the bill clearly shows what it will do and how it will serve Kenyans. And looking at the first part 2 of this, it establishes the establishment of the Social Health Authority. This authority is the authority that will help in doing everything, and the authority shall be a body corporate with perpetual succession and common seal, and shall in its cooperation be able to do different things. Madam Speaker, as I said, if we put into consideration all this, then we will be able to transform our country. And under the authority, one of the things that has really helped me to accept this is that it will manage, control, and administer the assets of the authority in such a manner and for such purposes as best promotes the objects for which the authority is established. In the past, as I said, in Kenya, we have a lot of policies, but unfortunately, we don't follow the policies. Sometimes we have so many even laws and regulations in place, but why we suffer as a country is because we do not follow. And that is why up to today, as a country, we have a big problem. But if we do this, then there is a hope for our country today. Again, under the authority, then we can also see that it is able to invest the funds of the funds not immediately required for its purposes in the manner provided in this Act under Section 38. In the past, Madam Speaker, people have saved a lot, even under NSSF and social welfare and all these other things, but accounting for that money again has been a problem. If we put proper measures in place so that for sure these monies are saved somewhere, are fixed somewhere, and it benefits all the members, then as a country we will have achieved a lot. But if the history will be the same, if the story will be the same, that Kenyans pay, Kenyans invest, Kenyans do different things, but the money is mismanaged, and sometimes they cannot even get any trace for the money, then we will not be able to achieve our goals. And I believe under Kenya Kwanza government, we will be able to achieve this because we have committed members, and together with that, we should have qualified staff in place, qualified personnel, whereby people will be put in their relevant fields, and we will be able to control everything. Again, part 3, the bill provides that primary health care fund. The primary health care fund is, there is establishment of a fund to be known as the primary health care fund, whose objects shall be to purchase primary health care services from health facilities. Madam Speaker, today if you go to our hospitals or dispensaries, our people cannot get anything in their hospitals. They are even referred to private hospitals or pharmacies to go and buy Panadols or any other thing. And if all the dispensaries, all the facilities in every part of this country, because sometimes we concentrate on the big town, big cities, and where we have financial muscles. If we can make sure that the services that we provide will go to every part of this country, and the healthcare fund will also be found or be sent to every part of this country, then we will be able to touch the life of everybody, and at even the grassroots level, so that this bill will not only be passed in National Assembly or mentioned that it has to be effected and the President has endorsed, but it will transform people's life. Again, Madam Speaker, the bill in Part 5, Part 4, has what they call the Emergency Chronic and Critical Illnesses Fund. In the past, we know, and currently, many Kenyans have been traveling to different parts of this world, especially India. The traffic is so huge, and as other members have also said, most of the time what we do is to collect funds, to fundraise, even on WhatsApp groups, and even through fundraising in the villages. That has really exhausted all of us. And sometimes you feel embarrassed because you have your neighbor who is sick, you have your family member who is sick and who needs the medical attention, and you cannot be able to assist. And sometimes members are even forced, or opinion leaders are forced to keep borrowing money so that at least they can be relevant socially in their villages. Madam Speaker, this Emergency Chronic and Critical Illnesses Fund will help every part of this country, and also the Kenyans who are suffering from chronic illnesses. Many people today, because of the frustrations and the problems that they have blood pressure, others have diabetes, and many people have been diagnosed at their old age or even as young as they are, with cancer and other illnesses that need a lot of money to be treated. And providing this will be a big relief to everybody in this country, and especially to the caregivers, and also to the people who are already affected by the different illnesses. Madam Speaker, I support this bill, and it is my prayer that soon it will be implemented. As I finish, I want to just touch on Part 8 of this bill, where they have talked about dispute resolution committee. And if a person is aggrieved by a decision made under this act, may within 1 month from the date of the decision appeal to the dispute resolution committee for review of such decision. This then means that even those people who have dispute or who have been aggrieved will have a chance to bring forth their complaints and to be catered for by this committee. And that then assures us that things will be different. Madam Speaker, as I finish, I just want to say that even those who are already working, it is good for us to make sure that Kenya is already suffering, and we should not add into that. Economically, people are suffering. We should retain all the qualified staff who are working in this area and make sure that those who need to be promoted will also be promoted. Thank you, and I support.